In 2021, nearly 370,000 IVF cycles were performed in the U.S. That is up 19% from 2020. But the overturning of Roe v. Wade could impact IVF procedures and other fertility treatments in some states. So exactly what does this mean for couples or single women that are hoping to have children? And listen, there have to be considerations and concerns around which states might be unsafe to have a child. Joining me now to talk about it is Dr. Bayo Curry-Winchell. She's a medical director and a physician. Doctor, thank you so much for being with us. So the overturning of Roe v. Wade and many anti-abortion and pregnancy termination laws across the country are going to impact how certain women can plan to conceive, especially if they're talking about doing IVF. Talk about how you see this showing up in practice.
So this is going to show up in so many different ways. When we think about the challenges that are just involved with IVF, and then you have the overturning of Roe versus Wade, as you're planning a pregnancy, and if you were to have any complications or any risk that could compromise your life or your baby's, or considered, a non-viable, which is something that we consider where this baby wouldn't be able to survive, the overturning of Roe versus Wade really impacts those families who are just trying to have a child, but now could possibly have repercussions.
Yeah, I know one of the things that we keep hearing about, in the reporting and even on social media are women who, exactly as you said, doctor, they're at various stages of pregnancy, some late term, finding out that the pregnancy is not viable, and really traumatic and emotional, devastating, heartbreaking stories of women having to carry and even deliver, children that are not alive. We're also hearing stories about how miscarriages are being handled in some states, and doctors are really having to choose between following the letter of the current law, which are new laws, and also just best care for the mother and the child. Talk a little bit about that ethical dilemma that some doctors are in right now.
When you look at the fact that certain medical procedures that you may need, such as having a medical abortion, because often people are not aware that sometimes that is necessary, is now in the hands of a government or the state. And so we have to look at how that disrupts care and how it can also impact the ability for someone to be able to save their life or possibly prevent complications. And so when we think about miscarriages, also ectopic pregnancies, which is a pregnancy outside the uterus, all of these things require a medical procedure, which sometimes falls under a medical abortion. And so these laws have really long-lasting effects for people to be able to survive.
Yeah, I'm so glad, doctor, that you brought up the ectopic pregnancies, and another place in which this is showing up a lot, and this one's close to home because I just created embryos last fall, the discarding of embryos for a variety of reasons. Perhaps you have undergone IVF or embryo creation because you want to have more than one child, or maybe not. Talk about how the new laws can impact this, the choices / the process of discarding embryos.
So, most of the time when you go through IVF, if you're fortunate, you are able to obtain several embryos. And normally after, you possibly have one delivery or two deliveries, you get to decide what would you like to do with those embryos. And that's a personal choice. However, with the laws that are, coming about, there is a concern that that could be considered an abortion. And so this really is a new kind of challenge for families as far as the embryos that they have created. Now the government has the opportunity or possibility of making a choice on what happens to those embryos.
Dr. Bayo, I want to ask you, now it's time to name names, right? When we talk about which states that we see in the headlines and we see their governors being very, very vocal on these issues, from your experience, which states do you think we should apply the harshest scrutiny when it comes to how women's reproductive rights are being handled?
Mississippi, Kentucky, all of those states that are already disproportionately impacting Black people from care and other factors are now imposing one of the harshest restrictions on the ability to access care.
Indeed. I'm going to add Texas to that list as well as many others. So,
Yes.
on that one, you've got to check the local statutes. Dr. Bayo Curry-Winchell, thank you so much for being with us. Coming up, single mom by choice, why more and more Black women are going at it all alone. Stay with us.